So the first class of medications that we use for acute pain control are what we call anticonvulsants. So your gabapentin and your pregabalin. What they do is they help to lower the firing of your nerves to help reduce that nerve-related pain that's common with neuropathy or things like that. So that's the first type of medication that we use. And this is the most common type, and the one that most people are familiar with is our pain control medications. These are your acetaminophen, Tylenol, and your NSAIDs, so Advil, Motrin, Aleve, things like that. So the purpose of these medications are to ensure patient comfort and to help promote pulmonary hygiene, and they have slight sedating properties. For the acetaminophen group, they are good with pain and fever reduction. So musculoskeletal complaints, any sort of broken bone, muscle sprain, that's what acetaminophen is really good for. NSAIDs, on the other hand, are actually inflammation reductors. So they are good if you have pain that's due to inflammation and increased blood flow, which again is also very common with musculoskeletal complaints. So anytime someone has an injury or an accident that causes pain to a muscle or bone, these are the two types of medications we prefer to use. In terms of an adjunct to pain medication, so these are medications that are not necessarily pain relievers, but they help to reduce pain alongside other pain management techniques. Steroids are a really common medication that are used to help reduce inflammation. They help to lower the blood flow to the area, so there's less swelling and less inflammation, which in turn can lead to less pain. There's also local anesthetics, lidocaine injections, trigger point injections. This is rapid onset of pain relief as the medication is put directly into the muscle that's the problem and can help provide almost immediate relief. For people who cannot take oral medications, so people with kidney problems, liver problems, things like that, there are a couple pain relief options that are not oral. One of the more common ones is lidocaine. You can get that in a patch, in an injection, or in gel. In this case, you're not taking it orally and it's not going through your system. Instead, it's targeting the pain relief directly to that site. Same thing with capsaicin, which is a gel that's derived from actually hot peppers, and so that helps to numb the nerve endings and reduce pain. There's also diclofenac gel, and so this is an NSAID gel, so it's like Motrin except it's topical and you put it directly on the area that's the problem. These are all different ways to help control pain that are not necessarily taking an oral medication if that's not something that you want to do. A common, very big one are also opioids. And opioids are most commonly used when you have a new acute pain. So surgery, you break a bone, and it's only really used in cases where the pain is resistant to other medication, and we try to use it for the shortest duration as possible. Because as many people know, opioids are highly addicting, and they also are really hard on your liver and kidneys to metabolize and get out of your body. In a recent study, actually, it was shown that ibuprofen, so your NSAIDs, plus acetaminophen were equally effective in helping to reduce pain intensity at 2 hours in compared with 3 different opioids and different combination of those medications. So we don't try to use opioids that often because of their adverse side effects. And we're looking to other ways to help control pain that doesn't involve taking opioids. Important to note that in all these medications, they are metabolized both through your liver and through the kidney in various forms. And so long-term use of any of those medications can be very harmful on your body. We tend to like to use them only for as little amount of time as possible. And in order to combat that, we recommend things such as proper exercise, chiropractic adjustments, and good nutrition, because all of those can help to reduce inflammation in the body and helps prevent you from having to take more medication than is necessary and reduces those harmful effects in your blood vessels, in your liver, and in your kidneys. Another very common medication that we use that's not necessarily a pain relief but can help are muscle relaxants. So this is when if you have pain that's due to spasm, if you were in a car accident and you have whiplash, these medications are really good at relaxing the muscles and helping to relieve any pain that's caused because of that. In terms of long-term therapy, these are for people that have chronic pain or chronic issues. There's a couple medications that we can use. One of the more common therapies that we use are actually antidepressants. So your SSRIs, your SNRIs, and your TCAs, they're used to help they are used to help treat neuropathic pain and if you have any concomitant depression or anxiety. And it has actually been proven that antidepressants are very effective for nerve pain. So if you have any sort of neuropathy, or if you have certain musculoskeletal pain like fibromyalgia or certain back pains, antidepressants are very helpful in help reducing that perception of pain. There are also some very rare situations in which these SSRIs and SNRIs can be used for prophylactic pain management. There are also nerve blocks or pumps, and this is used to deliver sedating medication directly to the source of the problem, typically in the spinal cord. This is a surgery where a surgeon will go in and insert the pump, and it delivers a constant stream of medication. And this is for these patients that have chronic injuries or accidents or pain that isn't going away or being treated with other more conservative sources. And there's also neuromodulation. If you've ever heard of deep brain stimulation or spinal cord stimulations or TENS unit, these help to modify the brain's firing to help reduce the pain. Again, nerve blocks and neuromodulation are used for more long-term issues with pain. We don't recommend them for any sort of acute problems. They're for people that have long-term pain that isn't going away, and we try to control that in ways that are not just oral medications. Obviously, any sort of pain control is going to be most effective when you combine any sort of medication with appropriate lifestyle therapy. Medication can only take you so far in terms of pain control. It is possible to have some internal damage when you take any oral medication long term, and there are a lot of new medications on the market that we don't know the long-term effects of. So when you are dealing with acute or chronic pain, it's really important to combine that with therapies such as physical therapy to strengthen and relieve the muscles, chiropractic adjustments to maintain proper alignment, and good nutrition, which can help to naturally reduce inflammation in the body. Subscribe if you'd like to stay up to date with information to help keep you healthy and pain-free.